Get ready for this bombshell. Mental health has just become a political power move. Here's what one major party is promising ahead of the election. The Labor Party just announced $1 billion for mental health. Yeah, that's 1 billion with a B. It's finally on the political agenda, not just because it matters, but because parties know it's what young Aussies want come voting day. Most of the billy is going into reactive services across the country. Let me break it down for you. This is from a briefing I had with the ministers. They are expanding those Medicare walk-in mental health centres from 61 to 92. The MMHCs have been around for a little while now, and most of them so far are just rebranded Head to Health clinics. They've copped a fair bit of criticism so far because a lot of people don't know they exist. Services can be quite patchy depending on where you live. Some clinics just aren't properly equipped to support young people with complex needs or potentially even culturally specific needs. And then the age-old wait times. Another bit of goss is that they are opening 20 youth specialist care centres, and these are for young people with eating disorders, psychosis and other complex challenges. You can pause and read this right here if you like. You'd probably need a referral potentially from one of those Medicare clinics to get into one of these youth specific centres. Also opening a National Institute for Youth Mental Health. I believe that will be a consortium of some kind. Headspace is getting upgraded. I have personally used Headspace. I found it to be comforting but not necessarily equipped for complex cases. They're focusing on new rural outreach and upgrades to Headspace Plus to support more serious cases. And before you ask, they're boosting the workforce with new training spots and subsidies for psychs, peer workers and GPs. Prevention, though, was barely touched. No major focus on school or uni mental health education. There was no funding for peer-led models like the kind that All Kind runs, where young people actually learn how to support each other before it gets to crisis point. When I asked the health minister about this, he told me to go and talk to the education minister. And that kind of separation of mental health in this silo worries me. We end up rolling out this $1 billion mental health plan across the country. We would need robust and transparent evaluation models to make sure that it's not just widespread, but it's actually effective, equitable, and truly responsive to communities' needs. So it's not flawless, but it's a start. And don't forget, mental health is multifactorial. There is no one-size-fits-all solution, and this is not the whole picture. So do your own research and keep having conversations. And if you do notice a gap in the services, in the support, in the system, tell someone about it because your story and your voice matters.